Here are some notes on acute aortic dissection, a very serious condition. The risk factors for aortic dissection include chronic hypertension, this is the biggest risk factor, underlying aortopathies like Marfan syndrome, and cocaine use, all predispose you to having an acute aortic dissection. Signs and symptoms: patients will have a severe tearing chest pain or back pain, and that pain will be maximal at onset. There can be a variation in systolic blood pressure between their arms, usually greater than 20 millimeters of mercury. That's because the aortic dissection can block the flow between arms, so one arm will have a higher blood pressure than the other arm. Hypertension is usually present when you have an acute aortic dissection. If you have hypotension, that suggests you might have an aortic rupture or other complication like cardiac tamponade or acute aortic regurgitation. So usually it's hypertension. Hypotension means you might have something else as well. Diagnosis: EKG isn't super helpful. You'll have normal or nonspecific ST segment and T wave changes. Chest X-ray might be helpful if you see mediastinal widening. CT angiography or TEE is used for the definitive diagnosis. Treatment and management: you want to control their pain first of all. You could use morphine. You can give intravenous beta blockers like esmolol. Sodium prusside can help if the systolic blood pressure is very high, above 120, despite the beta blockers being used. And you need emergency surgical repair for ascending dissection.